Okay, welcome to Virtual Roundtable from the Vermont Historical Society. Today we are talking about collecting the COVID-19 pandemic. And this is a follow-up to one of our original roundtables, and we're just going to talk through what some of the projects are and where people are at and sort of what we're seeing, and hope to keep the conversation going. Again, just for anybody who's not, certainly feel free to use the chat to ask questions or make comments if you don't want to say them out loud or don't have a chance to. But we'd love to hear from everyone and see how things are going. So right now I'm going to turn it over to Paul Carnahan, who's the librarian at the Vermont Historical Society, to talk about our COVID-19 archive. Take it away, Paul.
Okay, thank you, Eileen. Let me see if I can share my screen. So I think we talked about doing this last time. I forget how far along we were. Let's see, this is saying Google Chrome unknown. Share. Oh man, I have to open my system preferences. Privacy, what do I have to do? Turn that off? Allow the apps to record the contents of your screen. Okay. Will not be able to record the contents. Oops. Huh, anyone use a Mac? Do you know what I'm supposed to? Sorry, folks. I thought this was just, will not be able to record. Maybe someone else ought to go on, and then I will try to figure out this technology. Is that okay, Eileen?
Okay, so I will then pass it to Erica, and I'll make you the host if you want to share your screen, and we'll go from there.
Okay, good morning, everybody. For anyone who doesn't know me, I'm Erica Adonis, and I am the Director of Special Collections at Champlain College. So when this pandemic and stay-at-home order went into effect, I kind of scrambled to start thinking about how to document and archive the experiences of the Champlain College community, both faculty and staff and also students. And so working with some colleagues at Champlain, I launched two different surveys on Google. So they are accessible to anyone with a Champlain College login. And they asked a series of questions, and then there was a place for people to upload either a written reflection document or images. And then at the end of the form was some legal language providing a release for Champlain College to preserve and share their responses. So for students, that also included a waiver of their federal education privacy rights as students, which I really needed to make sure they ticked that box off in order to share their responses. So because Champlain is such a large community, I had to work with people in our provost office and our marketing team to get the word out. So I had, although they were really on board and excited about the project, I had a little bit of a kind of a back and forth with them about figuring out when the timing of the rollout could happen, because they were juggling so many other things. And knowing that we wanted to be really careful about when this hit everybody's inboxes, so that that people who were already kind of stressed out just dealing with everyday work life and student life weren't overwhelmed with yet another email. So the survey did go out on social media, and then it also went out in the provost newsletter that at that point was a daily news briefing, because things were happening so rapidly on campus. So over about a 4-week period, I got not all that many responses if you think about the total number of faculty, staff, and students at Champlain. I got about, I think 28 faculty and staff responses and about 50 total responses from students. So I'm actually really happy with that. And the responses I did get, I just was really impressed with the quality of them. I had 3 professors who chose to incorporate this into their classes. So the majority of the student responses came in as a response to an assignment. Unfortunately for me, some of those professors were better about communicating the need for the legal release part than others. So I'm now having to go and contact students individually just to follow up and get them to tick the box and provide official permission. So even though it was clear in the initial communication from the professors that this was an archive project and that their responses would be indeed archived, I don't have the equivalent of a virtual signature on a legal document. So I'm really crossing my fingers that now that the semester has ended, I'll be able to get some students to reply, because I was super impressed with their responses. I thought they were just incredible. I got, from students, I got half the responses were written reflection posts, and then the other half were actually photographs or images. One of the professors who did an assignment was for a photography class. So just some amazing work. And so I've already started to share out the responses. I had a request from our provost office to incorporate some of the responses into an update that went to our board about the transition to remote instruction. So I was able to send some really great kind of qualitative reflection comments back to the provost, and I'll be doing another summary round like that will go out also to our provost office and our Center for Learning and Teaching on campus to help faculty prepare for the fall semester. So I'll be able to incorporate some of these great student responses that I've gotten, I'm hopeful as well. So although I had intended really, I kind of was thinking when I put this survey together that I was going to get a really focused reflection piece about the Champlain community, which I did get. You know, in hindsight, I also got some information that reflects what's happening on nationally as well, because especially students, after the stay-at-home order went into effect, they all went home, or most of them did. So I've got responses that reflect their experiences in all over New England and Texas and Georgia and New York City and Philadelphia, upstate New York. Those are just the ones that I've looked at so far. So it turned out to be a kind of a picture of the broader experience as well. And I also got one response from an international student who remained behind on campus because this person was unable to return home. So it's great to have that perspective as well. So the survey is still open. I'm kind of trying to decide when I should close it. It seems like we're running up against kind of a natural closure point because we've hit the end of the semester. However, I am thinking about going back out and doing another round asking for objects, because I really could see just an amazing exhibit coming out of this, and maybe some targeted collecting as well. So I do have ways to contact faculty and staff directly, and I would have to go through the administration on campus to do another round of publicity to reach students. But I think it would be great to start that ball rolling. So I've been thinking about, you know, what kinds of objects I would want to collect, and of course also invite people to submit things that they feel reflect their experience and leave it kind of open-ended as well. So that's kind of where I am at Champlain.
Excellent. Sounds good. Shall I try to share my screen now, Eileen?
Yeah, why don't you go for it? So hopefully, hang on just a second. Make you the host.
Oops.
Okay, now I think you should be good.
Okay, let's see if I can do this. Oh, this looks much better. Okay, I think I have conquered the security settings. There we go. So I don't remember where we were at the in this process the last time we talked, but I think we were just getting off the ground. So a lot has happened since our last gathering here. This is an Mecca site, which I think I talked about last time. I won't get into that right now, but it's been up for several months. It's a crowdsourced site with contributions from our staff as well, mostly me. We now have about 250 items in the site total. About 90 of those were contributed by me or other members of the staff. And we now have, so we've got about 158, I calculate, that were contributed by members of the public. As I say, it's an eclectic site. I see that Bonnie is on this this Zoom meeting. She contributed 3 items that I just uploaded this morning. They came through. So you can sort of see a variety, the type of things that we're getting here. 3 photographs from Bonnie, a very religious piece, the Shekiana, a very reflective piece by a teacher here, Silver Linings to the Pandemic. She gives nice little background here, and then gives us a poem, presents a poem that she wrote on how her life has changed. So that was really nice to receive. The photo on the bottom right, food distribution, I did grab from BT Digger. I've contacted them now 3 times trying to get permission to use some of their images. Haven't received a response anytime, so I'd put that one up as an example. But by and large, the collection does not include commercial images. It does include state documents, however. I reached out to Forest Parks and Recreation, and they sent me a couple of PDFs that they have on social distancing. Department of Health, of course, has a lot up there. We did get 2 contributions from 2 students who must be in the same class. One a girl, one a boy, so that was sort of nice. After talking to, during the last meeting that we had and talking about permissions and stuff like that, I got a little more serious about that. And I did reach back to, when these were contributed, I did reach back to the student and or the parent asking for email permission from someone who said they were the parent to put these up, and got that quickly in both instances. So this is the beginning of this student's journal. This is a PDF, so the user just clicks on the PDF, and you can read the whole journal, RJ's journal. I haven't read much of this one. The previous one that I received from the young woman was very insightful, and really glad to have it. Um, I don't have any statistics to share with you on the number of different types of materials. Eileen has done a little bit of analysis. We are running some ads on Front Porch Forum to get a little broader geographic coverage. We paid to have ads run on Front Porch Forum. Those have been sort of dribbling in. Didn't create the wave of contributions that I thought I might get, but it certainly increases the awareness of the site across the state. One thing that I've been doing now, which I hadn't been doing when we first started, was assigning tags. I'm just going to show you the cloud tag, the word tag. The word cloud, there we go. The word cloud that this software creates. So this is a good way of providing subject access to the 250 items that are here. You can see most of the terms are relatively infrequently used. I'm not sure what the number is when it jumps up to a bigger typeface. You can see from this that we've got a lot of signs and a fair number of state documents. The state documents are selective, random, just grabbing some of the important ones. It's not a full set of state documents by any means. And Rachel may talk about that in a few moments. But if one clicks on, for instance, masks, one can see the items. We've seen those 3 images already. There we go. There's some more. This is cut off in the thumbnail view, but there's the sculpture in Barry wearing his mask, people creating masks, some information on how to wear masks, picture of a grocery store, clerk wearing a mask, and more. So that's a little overview of what I've done so far on the site, and I will stop sharing that and let someone else talk.
Great. Thanks, Paul. And I will say, along with some of the sort of advertising and marketing, we did do some goal setting for sort of the types of collections we'd like to get, as you said, the geographic distribution, some of the topics. And so still working on that and sort of trying to see if we can get someplace that's as a little more comprehensive. I don't know. I think, again, you're seeing a lot of these sort of some great personal submissions about sort of signs and closures. What we haven't gotten is, I don't think we've gotten, still haven't gotten anything that's first person COVID, anybody who's had the coronavirus and some of the more related experiences, from healthcare workers or anybody directly related to the virus. So that's certainly sort of an interesting thing that hasn't popped into ours, at least so far.
Are you guys thinking along the same lines as Erica about starting to collect objects or put out a call for stuff, or are you happy with the digital and leave it at that?
I'm happy with the digital. And Teresa, our collections person, hasn't jumped in. We've said we're going to collect items in the future on the site and just in times when we've been talking about it. But so far she hasn't jumped in. I've got a few pieces of paper, signs and whatnot, the actual things that I've picked up. But so far the physical objects people haven't really jumped into this.
Paul, so this is Amanda. I can actually jump in a little bit about this. I have had some email conversations with Steve and with Teresa both about.
Wait a minute. I can barely hear you. Can other people hear her?
Sorry, hold on one second. Sorry, is that better?
Yes.
Okay. I have so many microphones hooked up to this computer that I have to remember to always select a different one every time I talk on one of these. It's getting a little ridiculous. Anyway, so this is Amanda Guston, for those who don't know me, the public program manager at VHS. And I have had some email conversations with both Teresa Green, our collections manager, and with Steve Perkins, who's our director, who occupies the role of our curator, about the objects that we might collect. So we have had some background conversations about things like that. I know I've sent them sort of links to various things. We've also gotten some ideas in from people who just shoot us an email saying, hey, you should collect this type of thing. So I passed that along to them. And so we are sort of creating a list. I actually have been saving mail for you too, Paul. Next time I'm at the History Center, I will put it in a safe space for you, including things like I saved our economic stimulus letter, because I felt like that should be represented. And I also got a multi-page super duper religious pamphlet about the end times and how it relates to COVID that was really interesting. So so in terms of physical collections, I thought I'd bring those in.
Yeah, I got one of those too. Glad you saved it.
I set it aside very specifically, thinking this is an artifact of the moment for sure.
I don't know how representative it is, though. Someone had a lot of resources to put that thing out in everybody's mailboxes.
Yeah, it's not as much a presence in Vermont, being the least religious state in the country, but I think it's a little bit a part of the national story of people and their relationship to religion in this moment. I don't know. I've set aside a pile for you. I've also, like the Aldrich Library sent out a postcard to everyone saying, here's our situation right now. So that kind of thing. But yeah, and in terms of the physical objects, it'll be interesting to see what other kinds of things make sense to collect. Certainly we've had some internal conversations. Masks are a really obvious one. But what about those might be more interesting or different or speak to some personal stories is a question. King Arthur Flour just came out with a specially packaged 3-pound bag to combat the flour shortage. So I thought that might be an interesting interesting thing to collect. And I actually just read a huge long article yesterday about their response to dealing with. They had a 600% rise in their sales figures literally overnight. So they're a Vermont company, a longtime Vermont company, and part of that story. So that's the kind of thing that I know we've had a longish time. They started in Massachusetts, but they've been in Vermont for a while now. And this chapter of their story is very much part of their Vermont story. So that might be an interesting thing to collect. So we have had some conversations, nothing to my knowledge that has been officially sent in and proposed for accession yet.
So Rachel, did you want to talk a little bit about the archives project?
Absolutely. Yeah, I can pick up on what Paul was saying about kind of I know you've done some screen grabs and other things that you've added to your COVID site. And I've talked to Tanya about the archives approach, and it's interesting. Other state archives are doing web crawls and grabbing the fact that these websites are changing, that often are pretty static, have been changing on a daily, if not even more frequent basis. That's not been our approach in Vermont, and we are really relying on our record schedules and our existing relationships with agencies to ensure that the documentation of the state response to the pandemic will come into the archives, and those records that are deemed permanent, which end up being, 3 or 4% of all records created, will be preserved long term, and most of them will be digital, so they'll end up in our digital repository, VT Retain, and they'll come in the normal course of business. There hasn't been kind of a super ordinary attempt, in part because the agencies that are creating the majority of these records are also the ones that are working the hardest. And back to Erica and kind of the timing and the not wanting to impact or distract from the essential work that they are performing in response and now even in recovery, that we were kind of trusting our systems will bring in the records we want to retain for the long term. And I feel pretty good about that. I think that's an okay approach. Simultaneously, Preservica, who's the vendor we use for our trusted digital repository, they came up with an initiative offering a modest amount of free storage space to their clients to collect COVID-19 materials. And so Tanya decided that a good way to use this would be, and it was kind of, it coincided with her being approached by a couple professional photographers who had started their own projects inspired by COVID-19. So we're focusing on, and this kind of ties in with the larger goals of the Vermont Historical Records Program and partnering in civic engagement, of working with citizen documenters who have an identified project. We're supporting them in their work and will provide a long-term repository for those materials and provide access through our portal as well. So I've been working with these two photographers to determine, again, permissions of all the subjects, because they're primarily taking portraits at this point. But Andy Dubak, who's the main one we've been working with, he then shifted after he kind of documented his neighborhood. And he also, there's some really nice metadata to go along with these portraits, because he asked them for statements about, how has their life changed. He also helpfully, got their permission for their images and their words to be retained for the long term at the state archives. But he then pivoted and started documenting businesses. So he's got all of that he's gathering as well. I have not heard from him in the last week and a half or so. So we've set up places on our website to kind of talk about the story. There's the basic info is there, but I'm eager to get a couple examples of his work up and to then get into the real work of ingesting those records into our Preservica instance, and working with our IT person. And Tanya wants to be involved as well. So kind of been toggling among all the stakeholders trying to get this project underway. And then last week I had the thought, in part because I work, as Eileen knows, closely with the Arts Council through VACDARN, the Vermont Arts and Culture Disaster and Resilience Network. I started thinking about one of the things we could do to kind of complement what VHS is doing and complement the official state record that we are, as our normal course of business, also collecting, that maybe we focus our COVID-19 archive, since our first two folks we're working with as citizen documenters or photographers, that we focus on kind of the artistic response and their role in community recovery and healing. So I've talked to Amy and Michelle a bit about this, but again, this is still a very amorphous idea of how, are we going to have really large media files that we're then storing, of benefit concerts, or of the first time Lost Nation is able to actually open up and have a show again, or how are we gonna actually do that? So working with artists who work in media, still media, is a good starting place. So, and I've kind of been coming across, including a couple on your site, Paul, of artists who've done work and they've submitted it. And so I'm curious about maybe documenting that response and having that be the focus, again, because wanting to scope it somehow so it's not the same kind of stuff that you guys are doing, Paul, and and that it's pretty well defined. So that's where we are. It's not as far along as I was hoping to be by now, but we're making some slow progress.
Yeah, and I think the timing question is this sort of amorphous, both from what's still going on and what people might be doing for longer term reflections, or again, as we say, is there a line between what we're collecting for the initial stuff versus the recovery, and what that looks like. Is this a project that ends up being 2+ years? Because by the time we get a vaccine and get economic recovery, and do we loop that all in or not? And how?
There's another aspect of all this that I'd sort of like to get people's ideas on, and maybe some folks have some ideas. I was approached by one of our volunteers who's also a former journalist, and said, is anyone collecting the obituaries of all the folks who have been victims of the COVID-19 virus? She was sort of looking at the New York Times front page on Sunday with all the names, but thinking more than just list of names, but actually somehow collecting the obituaries or life stories. I'm using obituaries as sort of a shorthand. And I was thinking about that. I mean, that's sort of a collecting obituaries. I mean, that's sort of a traditional historical society thing. And a lot of people independently do that, and then pass them off to us eventually in their scrapbooks or whatever. So it sort of seems like something that's up our alley, but I started thinking about it, and I have no idea how to actually do it. And the volunteer, being a journalist, said, "Oh, we'll just contact the journalists." And I thought, yeah, like they're going to have time to worry about this. She suggested contacting AP. I haven't done that yet. I did contact the guy who's head of the Vermont Press Association. Used to work for the Free Press, now works up in the islands. Donahue? Yeah. Didn't hear a response back from him. I'm wondering if it's even possible to know who the victims are. I mean, I've been seeing a lot of obituaries in our paper, and you can't tell. People don't necessarily put it in there. I've seen a few. VT Digger started sort of a memorial area on their site, but there hasn't been anything put in there in several weeks. I mean, they unveiled it with great fanfare, and then it's been very static. So I don't know that they're really, if that's really a focus of theirs. I guess it would have to be again, another crowdsourced project, getting families to submit stories of their loved ones who they've lost in this. I don't know. The only other idea I had this morning was funeral home directors. I don't know if there's a way to reach out to them, but I'm sure there are. Well, maybe there aren't. I mean, they put obituaries up on their websites all the time. I was going to say maybe there's some privacy issues, but certainly once it goes up on their website, I think that must be, okay for people to copy those. But it would be sort of nice to know who these people are. And it seems the numbers are manageable. I mean, thank goodness we're not in a state that's been hit really hard. So yeah, Rachel, do you have an idea?
Yeah, I mean, I think there's 54, right? And hopefully that's where we're staying.
Right, that's right. No more.
Yeah, no more. We're done. I think there's a few ways into it you could kind of triangulate. I definitely would start with the known obits, and you're right. VT Diggers has had a number of them. I mean, there were those two twin brothers you know, Clem and Lem, or, you know, there was, and wonderful stories there. So gather the ones that are already out there and identified as COVID victims. And the Department of Health has started to put out incredibly granular information. Again, not lists of names, but there, and so there's only there's really a handful of counties that have had mortalities. So there could be some targeted.
I'll focus on
again,
the newspapers that cover those counties.
Those towns.
Yeah.
And potentially reaching out via Front Porch Forum, because I think the real hook I would think would be if you could get a family member, and again, being delicate about it and appropriate timing, but it's an invitation to tell the story of your loved one when you're ready, and to get family members potentially who are interested in sharing information about someone who's passed.
Yeah, those are good ideas.
And I mean, there's so few that I think that you could kind of identify, you know, all right, I'm looking for 3 women in their 80s in Chittenden County, who were at this long-term care facility who passed, and we don't know their names, but we know that much about them. And it's an interesting question too. I don't know, is that private information who's died, or could there be a list of names that could be shared at some point? I mean, I think there probably will be, and that there will be a memorialization at, you know, at the state level, that kind of like the Times, that calls out by name. I mean, it's a powerful thing. I mean, yeah, you can raise and lower flags in honor of those that have fallen to COVID. And we also love to, you know, take a big slab of buried granite and carve names into it. So my sense is those will be out there at some point. And I'm curious whether that's something that could be pried out of the state even now.
Yeah. Well,
for this kind of an effort. I think this is a beautiful project. I love it because it's so discreet.
Well, that was my other thought, was maybe someone else is doing this and we don't need to.
Yep.
And that's what I said to Donahue. I said, you know, if the media is collecting this, then I don't want to waste my time doing it too. But like I say, he didn't respond. But it's also an interesting sort of policy question, isn't it, about the role of the state and the need to memorialize these people, but their first preference is to keep the names private. It's the media has had a tough time pulling data from the state. They've been very reluctant. They wouldn't even release data by town. And actually, it was this guy Donahue who really pushed them to release some data. And then I thought it was amusing. They wouldn't release data for towns who had less than 3 people who had died, because that would expose those people to us all knowing who they were. And I'm going like, what? How would we know? You know, Montpelier has had 3 deaths and they're not going to tell us, or maybe, we don't know. They're not going to tell us. But anyway, we can't figure out who they are. But yes, there's also responsibility. You're right. I mean, it is very moving when people read out the names, and it's very comforting, I think, to the families too. So I think you're right. At some point, the state will come around, and maybe we'll start to get some of those names.
Yeah, and maybe, I mean, I might bap it back to the volunteer, Paul, and see if she can gather as many names as she can.
Need to do that.
Gather as many names as she can easily gather, and start with those. I mean, even if that's only 8 or 9, that's a large percentage of the total.
I should do that.
Because ideally the list of names will be supplied to you, that you won't have to do the legwork to come up with the 54 names. But the project actually can be then filling out the life stories of those folks.
Right.
And
Right.
really fleshing that out. And that's where, even if you have an obit, figuring out the appropriate time and way to approach families to see if they would be willing to share a photograph, to give some personal reflections, to maybe do a little bit more. So you've got a bit more of a profile for each of these people.
Yeah.
And then that could be a sweet collection, and I think would be really kind of useful for research and for telling stories in the future of this pandemic.
Yeah. Yeah.
I wanted to ask another question, which is I've been thinking hard about how to reach appropriate timing and vehicles for reaching people who maybe are more directly affected by this pandemic and therefore wouldn't necessarily have the wherewithal or the time to complete a survey or take it upon themselves to upload materials, like essential workers, folks who are really, or, people who are struggling with food insecurity. I feel like their voices are really important to collect. And, any thoughts that all of you have about doing that in a way that's sensitive to, privacy and timing would be welcome.
This is Amanda. I'm just going to jump in real quick. I wonder if this is Vermont is such a small place, and that's one of the nice things about it, is that I'm sure everyone in here knows someone who has been more directly on the front lines in some capacity. I'm thinking right now I have a neighbor 2 houses down who is a manager at a local grocery store, and I was like talking to him from way across the street the other day, and he was saying that his life has been completely insane for several weeks now. And I'm sure everyone has some kind of personal connection like that. So I don't know if this is the moment to like leverage staff or your social circle to reach out for people that have had more direct experiences of it. My husband works at the UVM Medical Center. He's not in a direct care capacity, but he has been going to his office in the hospital every single day and dealing with sort of adjacent administrative stuff. So I wonder if personal reach out is the right moment for this.
Thank you, Amanda. I think that's a good suggestion. And I have been collecting a list of people that I want to do targeted oral histories with. At Champlain, that's the people who work in food service who have stuck around to make sure that the 150 or so students who have remained on campus got fed for the rest of the semester. We had staff in our student health center who were responsible for students on campus, including a few who were self-quarantining because they had symptoms. That's all the information that I have for privacy reasons. And then hopefully somebody in administration will be willing to talk to me at some point, although it may be still too close to home to attempt that.
Yeah, and I think, again, Eric, I do think sort of this is, again, the timing question is getting people's experiences as they are kind of in them is great, because then they remember everything versus the later on, and are there ways to sort of to double collect on some of those really intense, stories, or folks who are really sort of in the thick of things in various ways. Yeah, but I think, as Amanda said, that right in Vermont, especially, it may have to be a bit more individual interaction and asking than otherwise.
Yeah, I wonder if essential workers, if there's a way to find either their listservs or their virtual bulletin board or literal bulletin board. If Amanda's husband could go over to the direct care side and put something on a board that says, we want to hear your story. When you're ready to tell it, please call Paul. That if there's a way to kind of plant the seed and make the invitation, and then as people and if people feel, and I imagine that for a lot of us, one of the ways we process trauma is to talk about it. So I think, and maybe talking to Andy at the Folklife Center about what, because he's probably thinking about this as well, and how to expand upon the Listening in Place project to engage with folks who, as they're ready, are able to. And it may be that a talking thing rather than a writing thing would be an easier format for people to engage with. But I think there are no hospital cases. They're observing 20 people now, and there's no positive COVID people in hospitals. I think we're almost at that time. But starting to extend invitations and being able to, if you get people taking you up on them, be ready to receive and engage with them. That would be, I think we're close to that. And for folks with food insecurity, I'm wondering about reaching out to Vermont Food Bank or others who are involved in these food drops that are happening, and I imagine will continue to happen, I hope they do, through the summer, just to see if it would be okay to have a table and a big sign, because people are going to be in their cars, but to just, we want to, or a flyer that they can go with the food box about, we want to hear your story. How is this? And you're going to have people who want to talk about it. So that might be a way to, again, to go where the people are whose stories you want to hear, and rather than just kind of hoping they'll come to you.
Yeah. So I wanted to give, I think Bonnie's the only one that hasn't sort of, looks like we lost Allison a little bit. So Bonnie, I don't know if you had anything directly you wanted to share about anything you're working on.
I just unmuted. Can you hear me?
Yep.
Well, I just want to thank you for letting me lurk. I think what you're doing sounds absolutely wonderful. And I will tell you, I have been looking at newspapers. I live in Royalton, and I've been looking at the Bethel Courier for 1918. And I may write something for you. I'm interested in putting some stories and some faces to the numbers who died in our area or who were affected by the pandemic then. And it's remarkable, really. Names are given in the paper, but there are very few obituaries. And I hope that won't happen again. So I'm very glad to hear what you're saying. And I'm also looking in the cemeteries here. And so far, I haven't found on any gravestones, any from 1918, any mention of this person died of this terrible disease. So anyway, I've been thinking about this a lot, and sort of what the historians for the future will want to know about what we're going through right now, and what wasn't recorded very well in 1918. So very gratifying to hear everything that you're planning to collect. The other thing that occurs to me is that if there's some way, because people are communicating this way and also on Facebook, and if there's any way to capture what people are recording on social media, Facebook especially, where sometimes people are writing long, I'll have one friend who's writing a whole blog on Facebook. Every morning she has paragraphs about her experience. And that could be interesting, I think, to capture very mundane kinds of things, but all part of what we're experiencing now, which is maybe mundane but unusual in most of our experience. Anyway, thank you again for letting me listen, and good luck. I think everybody's ideas are just terrific. Bye.
Hey, thanks for your help.
Yeah, thanks, Bonnie. And again, I think that that's a really interesting sort of the parallel, because we're making so many of the 1918 parallels right now with so much of this, that again, that idea of trying to find the names and the people and matching them up with the data of how many people died. I think it is sort of that interesting, oh, can we do it differently this time? I think it's also that question of the active versus passive collecting, you know, of getting those voices that we know we want represented, rather than just waiting for a diary to show up and that's all we have. And can we push it a little bit so that we do have a bit more representation in the types of stories and the type of information that we're gathering.
I do have one other thing to say, and that is that the diary from 1918 and Michael Sherman's pieces that are on the website are really terrific. And I don't think that you've put anything in one of the newsletters to point people to those, but they are fascinating to read, especially now.
Oh, good. I'm glad you enjoyed looking at that.
Mm-hmm.
So we're almost to 11. I don't know if anybody else has anything else they wanted to mention, chat about, go from here on.
Let's keep in touch about how our projects are going. Informally, we don't have to necessarily Zoom about it, but I might see you guys elsewhere.
You might.
I hope I get to see you elsewhere.
Definitely. We'll have some in-person meetings at some point.
Yeah, great.
Yeah, I think again, you know, maybe, you know, in a year or who knows what the timing is to sort of, maybe there is a time where we do actually do a gathering of folks and sort of talk through what we've got and what the results, quote unquote, were on some of these, at least initially. I think that'll be really interesting to sort of collect what everybody's doing, you know, the Folk Life Center and some of the local societies and even journalists in the press, and sort of see where we're at with what is the story that we've collected in Vermont.
Yeah.
Well, yeah, if and when you have another local societies meeting, this would definitely be a good panel discussion.
Yeah. Cool.
Well, thanks for hosting.
Thanks, Eileen.
Thank you, Eileen.
Thank you guys for coming again and talking.
Yeah.
Nice to
Rachel.
see you all.